Kidney stones are a very common problem that actually affects 10% of the population. They are particularly bad in the summertime when people are out there getting dehydrated, hanging out at the lake, and not drinking enough water. If you have a kidney stone and you're hurting really bad, and you know you have something bad going on, and you have an infection on top of that, you really have to go to the hospital, and then you have to get it addressed. Another big important symptom is nausea, vomiting, can't keep anything down. And usually if you go to the hospital and they can get your pain under control and your nausea and vomiting under control, they can get you out of there. But if you have an infection, you have to get that taken care of in the same setting. The reason kidney stones hurt is because they get in between a kidney and the bladder. So a lot of times, despite the name, the kidney stone that sits around the kidney is just quietly bouncing around, like a little lottery ball, if you will. But when it gets stuck in between that tube that gets the urine from the kidney to the bladder, that's when it hurts. And people always think, well, it's because the stone is moving. No, it's actually not. It's actually that the urine that's being made from that kidney is getting to that stone and not moving, and then it just blows back pressure behind you, and that's what really hurts. When we talk about the kidney stone pain, the kidneys, just so we know, are right back here, and there's lots of reasons to have back pain that you don't automatically think it's a kidney stone. Maybe you pulled a muscle, maybe you have a herniated disc, but an unrelenting, excruciating pain on the side. And then as the stone moves to the lower down into the closer to the bladder, it'll actually start to hurt more in the lower abdomen and even in the testicle for men, or for the female in the vagina. It can also lead to this feeling of urinary frequency, urgency, like you got something that just can't get out. So if you see blood in the urine, it is a sign that there's something perhaps going on, but it's not an absolute, like, I didn't see blood in the urine, I can't have a kidney stone. But more importantly, there's other reasons to have blood in the urine that could be very serious, like a kidney cancer or a bladder cancer. So we never want to assume that blood in the urine is something that's just, that's just an infection or just a kidney stone that must have passed. Blood in the urine has to be worked up.